Okay, guys, so I have a legitimate question. I've been seeing a lot on social media, and I've experienced this too working in the hospitals where patients are very set in their ways, I'll say, about things that they want and things that they don't want. And they're not necessarily educated in why they do or don't want those things. They're just going off of what they hear from other people on social media. So be careful about what you're telling other moms to do or not to do if you don't have an educated background in those things. If you do have an educated background in those things, then more power to you, and keep spreading what you think is right and wrong. But if you don't, you could be doing harm to somebody else. And let me explain just a little bit. There are many moms out there who say, I don't want Pitocin. Nope, I don't want Pitocin before, after, at any time. I don't want that medication. And then I've seen where moms have had hemorrhaging, which is bleeding too much, after they've had the baby, and they really need the Pitocin, and they're refusing it. And they don't know why they're refusing it. They're just refusing it because they heard somebody on social media say that they should refuse it. And then things can get worse, right? Then maybe you're going to need a blood transfusion later. And what if you didn't need that blood transfusion because it could have been prevented by just getting that Pitocin? And I know everybody has a right to accept, different treatments, different medications, but I just want it to be from an educated place. So I always ask my patients if they know why they're refusing something, because I think that's important to know, right? What's the patient's why? And if they don't have a why, maybe you can help them. Like, hey, let me explain it just a little bit more. So that's the first thing I wanted to say. And the second thing is just there's this, I don't know, barrier between nurses and patients these days, where I keep seeing patients who I don't know if they're scared of the nurses or what it is, but they feel like they know more just because they've seen some things on social media. So just because you've seen a couple moms say it on social media doesn't mean that it's necessarily true. Always fact check things with your doctors, midwives, or your nurses in the hospital. And don't be afraid to ask us. Ask us questions that you have. Hey, I heard this on social media. Do you think it's true? Rather than, I heard this on social media and I don't want to do that, and that's that. So just make sure it's coming from an educated background when you are choosing to refuse or to want something as well. So that's all I wanted to say today, guys. I just feel like each time I get here on social media, I'm seeing more and more moms saying, oh, make sure you don't do that, or make sure you do that. And social media is a good and a bad thing, right? Because yes, we're getting more and more information about stuff that maybe if you didn't pick up a book and read it all, maybe you wouldn't have heard that before. So yes, you're getting more information, but two, it can also be wrong sometimes. So just make sure you are educating yourself in the best way. Which leads me to, if you want a childbirth education class, don't hesitate to check mine out. You can get it at Gumroad, GUMROAD.com/babybumplife. And you can find my childbirth education class there. My class is about a 2-hour class that you get. Once you buy it, it's yours. It's me talking over a PowerPoint that I did, and it comes from a nurse's perspective on things. So I've taught childbirth for a long time. I've been a nurse for 16 years. Feel free to check that out, guys. And if you have any questions, please feel free to send me a message and let me know. Have a good day.